Hi everybody, I'm Amanda from Transcend, and today we're going to be doing a quick demo of breathwork so that you can get a glimpse of what it's like. So Olivia is going to be helping us with the demonstration today, and we welcome you to join us. So if you want to get yourself set up at home, we're going to be lying down for the breathwork, and just get yourself all nice and comfortable so that you can get started with us. So we're going to first just show you what the actual technique looks like, and then I'm going to let you know a little bit about what's going on biologically speaking. And then after that, we'll jump into about approximately 5 minutes of breathing together, and that should at least give you a little bit of relaxation for today. So if you're ready, let's get started. So Olivia, if you can give us a nice demo of the breath. So we're going to start with the mouth open. So we breathe with the mouth open the whole time, okay? Very good. So when we're breathing, we're thinking about expanding through the chest. I'm getting a nice full breath in. And then the exhale and inhale are connected. So it's sort of like this infinite loop, back and forth. That's very good. Good. So as Olivia is breathing, I'll just let you know what's going on here. So when we're doing this type of technique, which is often referred to as conscious connected breath work, we're actually reducing the CO2 levels in the blood, which makes it more alkaline. We're also able to activate the parasympathetic nervous system, which is, if you're not familiar with the nervous system, it's sort of like our rest and relaxation mode. It also, when we breathe like this, we actually end up reducing some of the blood flow to the brain, in particular, the frontal lobe. So we end up actually being able to access more of the limbic system. So we're getting into the amygdala and the hippocampus, and that's where we've got a lot of our long-term memories stored that might be suppressed, as well as a lot of our emotions that we might be kind of pushing down. So when we breathe like this, we're able to access much deeper into the psyche and find out what's really going on beneath the surface. So that's good. We'll have you stop there, Olivia. Great. So if you're ready at home to try, we'll do, as I said, about 5 minutes together. So if you want to get yourself all set up, and just before you do, take a look below at the list of contraindications. For most of you, you should be good to go to breathe, but it's always good to just double check to make sure that it's safe for you to do so. So once you've done that, we'll get you all set up, get nice and comfortable. As I said, we lie down, so we usually don't put a pillow under the head, but often we'll put it under the knees if that feels good to you to support your lower back. And make sure you're in some nice comfy clothes. So once you're ready, we will start. Now I'll have Olivia start to breathe. If you're not in sync with her, that's totally fine. Often we're kind of on our own breathing pattern. So that's great. Yeah. So laying back, start to take in some deep breaths all throughout the mouth. Make sure you're getting nice and comfortable, so not too much shifting around once you get settled. Good. So we've got some nice big inhales. And every time she exhales, she's picking up that inhale again. Very good. And you'll also notice that, sometimes when we're breathing, we'll have a tendency to kind of like purse our lips or do sort of some funny things with our lips, but she's keeping them pretty soft here, just keeping the jaw nice and relaxed. We want to really just release the tension that's in the body. That's good. So this is a very short session, but you might feel some tingling in your body. Sometimes when we breathe for a little bit longer, typically, we get a little bit of cramping in the hands. We can get what's called tetany. And that's just a temporary decalcification in the blood, and it just causes your muscles to tighten up a little bit, and that goes away every time. So if you have any of these sensations, just know that these are really common and they go away after you're done breathing. We also get a bit dry in the mouth, which is a little bit uncomfortable, but it's just one of those things that you need to push through when we're doing breath work, and typically goes away after about 5 or 10 minutes. So you'll probably get a bit of a dry mouth today, but just see if you can really just push through and focus on your breathing. Very good, Olivia. We also tend to get a lot of mind chatter and a little bit of sabotage from the ego when we're doing breath work. So it'll often say things like, oh, this sucks, or I don't feel like doing this, or it might remind you of like, oh, I forgot to pick up bananas this afternoon, or something like. Any of these things are really common, and it's just the ego trying to kind of stay in control. So we want to just allow any thoughts that come to mind to just pass and not attaching to anything. And if you do want to talk to your ego, you can say something like, thank you, I don't need you right now, you can come back later. And that way we're just still approaching it with a softness and kindness, and not engaging in any form of internal combat. So at this time, I invite you to start to really sink in a bit deeper in your body. Start to feel a little bit heavier in your body. That's good. Very good. We'll just have you soften the exhale a little bit, Olivia. Okay. Nice and fluid. Okay. Good. Now, if you're at home and you have somebody that you feel comfortable with, sometimes some touch is really nice and soothing. So you can ask for that, or if you're taking turns, be sure to ask permission if this is okay. Generally speaking, I suggest that if you're doing breathwork for more than just a few minutes or so, to work with somebody who is a professional, just because sometimes we can get into some really quite deep stuff, and we want to make sure that we're healing things and not bringing things to the surface and then causing sort of more challenges. So we want to be able to work through them with a professional so that we can actually get through that material and have some real deep healing happen. So if you are looking for some more support, I encourage you to reach out if you want to do longer sessions, like a whole hour of breathing or so. It's really good for, if you have anything that, some behavioral patterns that you haven't been able to break, some self-limiting beliefs. Maybe you've got some old traumas or some blocks. There's really almost endless ways that breathwork can help. Even things like relieving stress, or things that you've got maybe some psychosomatic conditions going on as well. So it's a really beautiful practice if you, if you're looking for any personal development. So